Welcome to the Beyond Physio Podcast, where we help you move, excel, and inspire others on your journey to your next level with knowledge and advice from experts and testimonials from our like-minded community.
In our episode, we cover topics like tendinopathy. What about things like ibuprofen, Advil, and Tylenol? What do these things have an effect on? Are they helpful for athletes who are trying to mitigate pain? We also talk about how we can incorporate not only a rehab phase protocol for strengthening, but also a strength phase and a power phase, which has very specific kinds of activities and dosages to make sure that our athletes get back to their sport, high performance, but also so that they have a little bit more confidence and a little bit more hope that they will be able to continue on what they love to do. So I hope you enjoyed the episode.
Cody, thank you so much for the weekend. I learned a lot. And even though I've been out in the field for over 20 years, it's always great to be reminded of I might have forgotten before. But also seeing that what we do in the clinic validates what we're doing right now, which is really kind of cool for us. But thank you so much for that, number one. Number two, I want to dive into some of the things that maybe our colleagues out there are missing out on in physical therapy, especially when we're working with the athletic population. We happen to specialize in runners and hybrid athletes. I know you see a lot of the similar athletes. What do you think traditional PTs are missing out on that maybe you and I are covering?
Yeah, I think with traditional physical therapy, it's that stopping when people are coming in with pain, and that's the main focus, is like getting people out of pain, as opposed to trying to help facilitate, even with injuries, people that are active and hybrid athletes, like they're pushing their bodies. And so aches and pains come up, but it's trying to keep them in our circle, in our bubble, so that we can kind of nip those things in the bud before they become a bigger issue, and facilitating their fitness while navigating injuries, figuring out what can we continue to do at a high level while potentially we might need to back off of some potentially other areas while that small injury might be healing.
Right. And I think you landed on something really cool there, which is that I think a lot of fitness athletes tend to think that there's a lot of doom and gloom. It's like, well, I can't do this anymore. And I felt like after taking a course like today, that there's a lot of hope for athletes to continue doing quite a bit. And they don't have to maybe necessarily miss a step in their gains or whatever the performance goals are.
Yeah, absolutely. And I think a lot of times, especially when we're dealing with high-level athletes, there's always, and people who are trying to push, there are always holes that they can fill. And sometimes these small injuries might be able to give them a window of opportunity to fill some of those holes that they might not always lean into.
Yeah. You know, it's funny you say that, because I find that some of our athletes, once they have an injury, they realize that their mobility sucks. And so now they're like, oh, this is actually a good time for me to work on this. I'm like, it's going to make you more bulletproof in the future.
Absolutely.
Now, as far as I loved the framework that was provided by ICE. And we talked about things that we can include as clinicians, whether it be the strength phase, the rehab phase, or the power phase. And while I knew these things in clinic, it was great to have that framework. Can you walk us through what that looks like as far as helping our traditional PTs out there who might not know these different phases and what's included as far as rep count, weight, and that kind of stuff?
Yeah, absolutely. So the way that we really like to think about it in a very simplified approach to make it manageable for the clinic is, if we are really trying to challenge someone's overall top end strength, like a 1 rep max, the best way to go about that is going to be having them work at those more compound lift, 5 sets, 5 reps, with a 3-minute rest in between, right? At about 80% of their 1 rep max. So we need to be able to challenge that 1 rep max and know where that intensity lies to be able to really challenge that true strength if we're trying to build that up. If we have someone that's dealing with some injuries, or we're trying to challenge more local tissue, we like to live in what we call that rehab dosage, where in the PT world, we're going to spend a lot of time there. And we have some pretty big buoys there, somewhere between 8 to 20 reps, or of 3 to 4 sets, 30 to 80% of that 1 rep max. But we use their irritability and what they can tolerate at that time to shift whether they can do more high rep, low intensity, or lower rep, higher intensity, to get them in and out of pain, get some blood perfusion there. And then ultimately, if we can challenge from a power output standpoint, that's really where we need to make sure that they're staying at a velocity that we want that's going to facilitate power. And so that's going to be really only going 3 reps at a time, but we want to get 10 reps. We still want 10 sets. We still want enough volume where the intensity is going to be variable some depending on, do we still see that velocity maintaining to train power output?
And I'm glad you said that, because I feel like, and I know I've been guilty of this in the past, where after today, I was reminded that during the strength phase, we really have to load them up quite a bit. No more pink weights, no more, yellow resistance band. It's really, we got to make them really super strong so they can handle the loads when they go into the power phase.
Yeah, absolutely. And when we're dealing with the hybrid type of athletes that we have, yeah, absolutely. Most of those are not going to be touching a yellow TheraBand or a pink dumbbell ever.
Yeah. Correct.
There are those people, like in a traditional clinic, like some people come so deconditioned that it might be where we start because that might actually be their true like 80%.
Yeah.
But the reality is, if they're doing that for longer than a week or two, we probably have not progressed them appropriately and maintained that same intensity level that we need to get them stronger.
Absolutely. And it sounds like if I were to, after taking my takeaway from the course, was that number one, we got to make sure that we are loading appropriately for sure, but also making sure that when we do make that transition to where they go to that power phase, that we have to build up to that as well.
Absolutely.
Cool. Finally, I wanted to ask also, as far as the tendinopathy is one other question I wanted to bring up, because the notion out there is that, oh, well, if I have a tendon issue, it should go away within a certain amount of time. But we know from the research that it might take a lot longer for us to get to the goals that we want to get to.
Yes. Pretty consistently challenging those tendons to truly resolve a tendinopathy. And when I tell that to patients, usually that comes with a bit of sadness, right? Saddling up for that amount of time. But you can still give them confidence that they're not going to be feeling the way that they currently feel for 6 to 12 months.
Yeah.
Right? It's going to be a progress of, right now, maybe you are acutely kind of feeling like 7, 8 out of 10 pain. That's pretty tough. We can drop that pretty quickly, but will you feel some lingering tendon type things for potentially that 6 to 12 months? Yes, but in that period of time, are we going to get you back to being able to do all the things you want to do? It's just, you're still going to have in the back of your mind the loading and what is appropriate for me at that given time. And they might still have to have some navigating of that for quite a while.
Yeah. And another thing I was reminded of today in our talk on tendinopathy was that, and this is for all of our audience out there, we have known this for a while, but it's become more and more common knowledge that we should not be using NSAIDs. So things over the counter like ibuprofen, even Tylenol, because that actually might hinder the healing process, which is what we actually want to have involved.
Yeah. If at all possible, stopping taking those NSAIDs is going to be your best bet. Our bodies are incredible healers. They do a very, very good job if we let them, and NSAIDs are not really allowing that to happen. So if we can pull those out of the equation of healing, we will really be better off for it at the end of the day.
That's awesome. So Cody, I know you also have a practice. Where can people find you if they want to learn more about working with, they have different kinds of injuries and they are hybrid athletes? I think you're down in South Carolina.
Yes, we are in Greenville, South Carolina. We have a clinic called Onward Physical Therapy in Greenville. We have a couple clinics there and specialists in the hybrid athlete, fitness athlete, running, pelvic floor specialists, a lot of headache treatment and TMJ type of treatment as well that we'll have. A lot of people coming in for that. So yeah, we love what we do and have a good time doing it. And it's been great.
Cool. And Cody, thank you so much again for sparing a few minutes before ending the class. I know you're really busy, and looking forward to driving some people towards your direction down in South Carolina if that need ever comes up.
Absolutely. Thank you, man. Yep.
Thank you.
Well, that's a wrap. We just did a really short but sweet episode with Dr. Cody Gingerich from Onward Physical Therapy down in Greenville, South Carolina. He was also the instructor for the course on upper and lower extremity management, which I found to be very valuable. I'm definitely going to have my team take a look at this course. And of course, I want to thank CrossFit TTG in Raleigh for hosting this course.
Thanks so much for tuning into today's episode. It really does mean a lot to us. And don't forget to like, share, subscribe, or comment if you got at least one or two helpful insights or takeaways to help you get to your next level.